I will, one, two, okay. So this is what we need to do, a lot of washing, okay? A lot of washing here.
Yes, sir. On actual checkout, would you have a new basin or would you use the one that you use a partial right there? If you get a minute.
For checkoff?
Yeah.
No, you're not using a new one.
Okay.
Yeah, you would just make sure you pat dry this one and then grab it again. Okay, so knock, knock, knock.
Yes.
Clean my hands. Okay, come in. 100% privacy is provided. My tabletop are originally clean, so I'm gonna go ahead and put my stuff down here. Okay. I'm gonna go ahead and then open up my stuff. Everything in my hand is clean. Put my basin, my supplies out, and here. With Cath Care, you're not taking off the gown. Okay, so you saw I didn't bring gown in. So you're not taking off the gown here. What you're doing here is you're still following the water steps and the rest of the stuff, and we'll show you how to put this on. All right, so now I'm gonna do your Cath Care. Well, before I step out, we'll hand sanitize and then do your safety check again, okay? So I'm gonna hand sanitize. All right. Your bed is low and it is locked. I'm gonna hand you your call bell, Mr. Tien, and I'm gonna step out and gather my supplies and I'll be back, okay? So here, I take my basin with me, slide out, 100% privacy provided. Come to my sink here, open my faucet. If I have two, I'm gonna open both. If I have one, I'm gonna bring it in the middle, okay? Depends on what they have. So if there's one, I will just bring it in the middle like this. Since I have two, I will go like this, and then I will fill up my basin. Get your basin at 2. Why did I bring this out? I need to take it back in. Get the basin right to 2. It will give you what you need.
During the actual appeal, will they verify that 105 or can you just say 103?
You verify, but again, it's subjected to
the examiner.
When you guys did hand washing health science too, did I test it?
Yeah.
Yeah. So it was my judgment to test it.
Yeah.
Another teacher may not test it once you say it.
Your
So-
peers, if you ask few of them, when they were doing the water, the hand washing, the examiner didn't check the water.
But you could find one that would
You
test
could
it.
find one that
If
could,
it's, like, let's hypothetically,
Mhm.
if it is over 105, what would you do?
if it
But
all-
they're not going to check the temperature. But if you touch it, I mean, they're not going to look at the actual reading. But if you touch it, if it's extremely hot or extremely cold, they will feel it.
they will feel it, yeah.
Like when I test the temperature with you guys, I didn't look at I didn't put a thermometer on there.
To
But
see if
some
it's
students were
105.
extremely hot, like
Uh-huh.
you sky your skin, or it's very cold, and I would ding you for it. So similar thing.
Okay, so put it in, 105, and you just verbalizing, 105, I use it here. So I'm going back in, okay? Privacy provided. I'm gonna come back here. Before you put PPE on, you wanna hand sanitize. When you're putting your hand sanitizer on at that site, penny size, not that much, because you don't want to, got 30 minutes, you want to put it enough the way you just rubbing it dry, quick. So I put my gloves on. I'm gonna check the water in front of the patient and let the patient check the water. Ooh, feels good. All right, Mr. Tien, can you check the water for me, please? Now, it depends on the examiner. She might say, give it to me, let me check it, but it's the mannequin checking it. If she says that, then hand it to her, okay? I'm gonna take your call bell because I'm here. I'm gonna go ahead and then, oh, temperature is good, thank you so much.
I think it's off.
All right, now here, I need to put this on this mannequin. Under the mannequin, it's a bleeding protector. To do so, there's 2 ways you can do it. You can lift your mannequin without exposing your mannequin right now, lift your mannequin leg up. But this is gonna be difficult for you to do. So what you will wanna do is not a human being to say, please lift up. Lay your mannequin down. Come across quickly and put your side rails up.
Oh.
Okay? Bring your mannequin towards you, Mr. T. I'm gonna bring you closer to me because I'm gonna turn you to the side, okay? So I can put the linen protector under you. Pull him over, bend his leg, and turn him. Okay? Put his hand across, making sure that you still keep him covered. You're gonna put your linen protector. Many students fail this skill because they forget to put a linen protector on and they forget to take it out. Whatever you bring in, tell your mind, I must take everything I bring in, I'm gonna take it out. So your linen protector goes over your patient like this. Fold it in half, okay? And then roll this in. Put it here, under the patient.
And which size go on the patient? Which color?
The white one.
The cloth.
The cloth side. It could be a different kind, but the softer side touches the patient's skin. Okay, so you
Plastic go under to protect it from hitting the bed.
okay? All right, Mr. T, I'm gonna pull you over, okay? You're gonna feel a hump behind you. So hold your mannequin and pull your mannequin over. Okay, just like this. Here, you're gonna tell your mannequin, I'm gonna be your side rail. I'm gonna turn you towards me. So you turn your mannequin towards you, and then you're gonna pull your linen protector on the opposite side from him. Then you're gonna put him back in bed. Okay, just like that. You're only now gonna expose the area you're working on. That's all. So here, I'm gonna roll this down. Okay? And I'm gonna roll his gown up right here, just like that. It is not gonna be a male catheter, it's gonna be a female catheter, okay?
And in your book, it says female.
It says female. So here, you wanna wash the catheter. So you grab your first towel, your full size is applied here as well. Squeeze it, put your soap on it. Okay. Grab your first flap like this in your fingers. You're gonna hold the catheter at the meatus. Your book clearly says to go 4 inches. I'm not a mathematician, okay? I'm not gonna decide what is 4 inches here. I'm gonna bring wipe all the way down till I get here. That will cover my 4 inches. It will cover me completely. Are we clear? So holding the catheter at the meatus, the examiner wants to see that your gloves is almost touching the labia, the lips of the vagina. Because this catheter is inflated. Remember when I showed you guys the catheter, the balloon is in there. If you talk on that balloon, you're gonna tear the lining of the bladder and the patient will start to bleed. So you wanna prevent that. So you hold the catheter at the meatus, okay? And you want to say that. So I mean your fingers will be holding close to the lips of the vagina. You want to encircle the catheter into your first slab and then bring it down. That's one. Bring this down. Grab your next one. Holding the catheter at the meatus, enclosing it, going down. That's 2. You only need to do this 3 times. Holding the catheter at the meatus, wrapping it around, third, you're done. That's your wash. Put it here. Grab your wrench. Make sure it's in your full. Grab. Holding the catheter at the meatus. Bring it down. 1. Uh-oh.
I need some new towels.
I need to order some. Holding the catheter at the meatus. Going 2. Make sure that your towel encircles the catheter. Okay? Holding the catheter now at the meatus, my third swab. It encircles it, I see it around it, and then I go 3, then I am done. Here, I'm gonna pat dry. Holding the catheter at the meatus, encircling and patting dry. Pat, 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 pat. That's 1. Get my second. Holding the catheter at the meatus, let it encircle. Pat, 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 pat. That's 2. Holding my catheter at the meatus, pat, 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 and I am done. Okay, here, I'm gonna position my catheter, okay? I'm gonna cover my patient. Then I need to take whatever I brought in out. So here, I'm gonna tell my patient, I'm gonna bring it closer to me, turn on the side, I will cover my patient up, okay? Drop this, and we turn to the side, just like this. I'm gonna hold my patient if I need to. I'm rolling inside out, guys, inside out. Cover my patient here, turn him over to me. I'm the rail here. Away from me, roll it up, lay my patient down. Okay, put this here, like that. Take my gloves out, inside out, my 2 fingers, hand sanitize, do my safety check. All right, your bed is low, it is locked. Here is your call bell. I'm gonna go around and put my side rail back down, okay?
Why? Because the outside rate, or you restraining that patient?
Patient is a restraint. Okay? Clean my hands now. I've done my safety check, my side rail down, everything's done, then I put on my last set of gloves.
No. You
Wait,
put it
why
on
did
your
you
arm.
say that it would, I had to go down this way?
Which one?
Why did you say that?
The side rail, restraint.
This should go?
Okay? We're a restraint-free environment. Okay? Here, drop it in, drop it in. So you see why this is important? This cover is important because it allows you to roll everything up and hold it. But as you will try to be holding these things individually. Okay, so take this here. It gives you a hold. If you got small fingers, you don't have to practice. Hold everything away from you, right? And then you slide out, look at it, pull if you need to pull. Come here. I know everything in here is dry. Put this here, put this in. I'm gonna dry it in. Like that. Okay, grab my wet.
get to the VA, when you go in on these skills, everything stays in the room. You're not gonna be taking this outside. So that's for me. I know we're kind of dealing with two different things. We don't want to see gloves to your hand, second taking real dirty linen to the dirty linen place. But everything else, like if they have a basin, if you have the soap, everything will be in the room. So you're not gonna be bringing that in and out. So you can remember that.